Okay, so today's topic is what pharmacy services. Okay, you also have the copy with you, right? Um, the lecture. So you can also refer if you cannot see very well here, that it's too small font or anything. Okay, so but what pharmacy services? This topic is very simple and it's not very comprehensive because our main core, even there is no work pharmacy services at the hospital, it's fine. Because inpatient pharmacies will cover the job of the ward pharmacies. So ward pharmacies is also called clinical pharmacies. Okay, so they are stationed at each ward. So you are supposed to specialize in diabetes, in endocrinology, in surgery, yeah? And in ONG, for example, in obstetric and gynecology. You can delivery kan, mothers giving birth and all of those things. In pediatrics, for example, so you are supposed to specialize in master clinical. Okay, you need to take the master of clinical pharmacy. Then you are specializing. You learn everything, all body systems, but you are specializing at that hospital on particular discipline. For example, like renal, kan, okay, kidney, medications associated with kidney diseases. So you akan tailor the doses based on the patient's conditions and choice of medications. You closely monitor. So this is not our main or core services at the hospital. And what pharmacy or clinical pharmacy is not very well developed in Malaysia. Okay, we we have some, but because there are not many there are not many positions available at the hospital for ward pharmacies. It's not very well established discipline, and of course, if there are more positions, then you are able to become the clinical pharmacist or ward pharmacist. But since lack of funding and resources and personnel or whatever, then uh, uh, we don't have much many position in clinical pharmacies. Um, and some if sometimes if they even have one position, the pharmacist will cover many wards: surgical, medical, pediatric, ONG. So they have to cover many wards. Okay, so it depends on the hospital. If it's very well established, then they have like several ward pharmacies or clinical pharmacies. So what you need to take note here is that, of course, it sounds cool to become a clinical pharmacist, but it's not always the option for you. You cannot be too selective. When you work at the hospital, when you go for the interview, you always want to become clinical pharmacist. Um, there is no such thing, okay? Because when you work in the government, kan, in the private, administrative and management is always involved. So you will also climb up the ladder in position, kan? So you cannot just if you go to for interview, then you just want to become or what pharmacist. No, there's no such thing. And in inpatient pharmacy, we also do some tasks of the ward pharmacist. But we are going to, okay, I will just explain how it works for clinical pharmacists. Okay, so during your PRP, you will also be attached for 3 months usually as clinical pharmacist. You follow the senior clinical pharmacist to do the walk round with the specialists and the staff nurses or the MOs or the doctors. Um, so usually in the morning, like this kind at 8 o'clock, and then you come here, you come to the hospital to the inpatient. Here actually they are always stationed at inpatient, and they go for around every day, and then they come back to inpatient. They collect the medications and do the bedside counseling or whatever to their own ward. If let's say they are in charge of ward 3B, so every day they will go around with the team, with the clinical team, at ward 3B, and they are taking care of their patients very closely lah every day. Okay? And they know all their patients. Let's say kalau in ward 3B tu ada 25 patients, or 30 patients, they know every single thing about their patient. All the parameters, any changes happen every day, they know. Okay, so because that's their job, uh, because anything happens to the patient, they are responsible. Okay, so okay, in the morning like this, okay, at 8 o'clock, you check in, and then you need to review the medication chart and also the medical notes and the clinical notes. Okay, let's say for the patient just admitted yesterday kan, to your ward, to 3B kan. So you need to get the form. There are 4 types of form: CP1, CP2, CP3, CP4. So the medication history ni in the morning ni memang you buat lah. Okay. If you see if you look at the notes, you will see lah the types. There are 4 forms, right? Right. So CP1 tu apa? Medication history, right? CP2 apa? Apa CP2? The form for what pharmacy? This is being used at the KKM lah ni, at the Ministry of Health.
Pharmacotherapy review.
Sorry, Syafika?
Pharmacotherapy review.
Pharmacotherapy review. The CP3?
Clinical pharmacy report form.
Okay, clinical pharmacy report form. And CP4?
Discharge referral note.
Discharge referral note. Okay, so these are 4 types of form that you use for as a clinical pharmacist. So inpatient pharmacists, they don't use this. They have lots more workload, okay, to complete, and they don't have time to see all these things. So your job in the morning is clerking the case. Let's say this is new patient, you buka satu lagi form and file kan. Then you write lah, you jot down everything from the clinical notes kan, regardless lah. Kalau macam it's a computerized system, you just log in your account, and then you access all the patient, type the RN number, and then everything will appear. The clinical notes, the medication chart, and the lab parameters. How's the kidney function today, and the blood, the infection, the WBC. You have to know all the clinical parameters and interpretation. Okay. Oh, the WBC has increased a bit, although you have given the antibiotics yesterday. So how long you need to continue this antibiotic and to drop the WBC to the normal level? So usually the normal range, you will just, it's at your fingertip there. So kalau you dah check up, okay, today is 23, it's very high WBC. So what's your target? And then you have the pharmacotherapy plan, review and plan kan? In the CP2 lah. So in the morning too, you complete the CP1, all the history, medical history adalah dekat clinical notes tu. Kalau lah bukan computerized system, you have to go upstairs to the ward and check the patient and bring the form and clerk the case. Clerk one by one lah. Okay, and you can also interview the patient, but usually at 9 or 10 o'clock, you will follow the ward round. So usually you don't have much time lah to complete all the but if you are efficient enough, you will complete lah. Okay, so tapi kalau macam dah ada 5-6 orang kan, new patient, then sometimes you just need to review briefly to make sure you know what is the case about, so that you will not be blur lah masa you clinical work around dengan specialist, dengan doctors, nurses, all the teams. So you need to even hafal lah the medication. Oh, this patient ni, makcik ni, dia ambil ni, and then they started this antibiotic, and then what's the dose? This is not suitable, so I will discuss with doctor. So you need to plan what is going to happen during the work around, and then what is you need to anticipate the questions from the specialists or doctors about whatever medications or dosage they want to know. Okay, you can so that you can always respond during the work round, during the clinical round. Okay, they will ask lah, macam dia orang interview kan the patient, and then they discuss what the management done by the doctor in the past few days, and then they will ask pharmacist, is this okay to give this medication with this dose while the patient is having this, and then you need to find out the information on the spot. Okay, usually you can answer on the spot lah, or you have the apa tu drug info handbook and all the online resources ke, then you provide the answer on the spot as a clinical pharmacist. But if you don't know, you are still allowed to ni lah cakap lah you are not sure yet, so you will check as soon as possible to respond to them. Okay, you can contact other pharmacies, or kalau it's about DIS, you can contact the DIS pharmacist, drug information pharmacy. Okay, but you are also functioning as a drug information juga lah. Everyone at the hospital needs to have the skill of drug information services, because regardless you are DIS or not, drug information service or not, you have to know the skills of searching for information. So apa tu you review kan the chart, and then okay, let's say 25 patients, tapi adalah patients yang dah seminggu masuk or yang dah sebulan masuk so you are very well versed dah ni the progress of the patient over last week, over 4 weeks kan. So you still need to ni buka the old file tu yang dah 4 weeks tu, and then today berapa hari bulan, and then what's the progress, everything, and then apa yang naik, apa yang decrease, the lab parameters, what's your ni lah kan suggestion ke apa yang you nak ni plan apa. And then pharmacotherapy review yang CP2 tu lebih pada medications lah, medications, and also when you interview the patient tu, if there is any supplements or herbal medications or anything lah yang luar-luar tu yang dia ambil tu kan. And then you can also check for any drug-drug interaction, the DRPs lah. Have you learned about DRPs? Drug-related problems or pharmaceutical care issues? Tahu tak examples of drug-related problems? Types, categories of drug-related problems. Do you know? You need to know lah, at least for third year ni you akan guna sampai fourth year, sampai you practice. Have you learned about the categories of drug-related problems? In the word pharmacy notes ni ada tak? Cuba you tengok, ada tak? Categories of the RPs. I'm not sure.
Ada.
Ada apa? Bagi contoh.
Untreated indication.
Okay, untreated indication. Lagi?
Improper drug selection.
Okay. So all this ni must be memang you dah familiar, and then you when you see the drugs you already know. Oh, why the patient was given these three combination? Because there's no way it's gonna work, or it will cause serious adverse effects. You already know. That's the knowledge of the clinical pharmacist lah. Okay, so all the drug-related problems tu you dah tahu dah. You nampak ni, oh this is the category. Oh this is not supposed to be given kan. Oh duplication ke apa semua macam tu lah. Alright, so you need to justify lah. You have the reference and semua tu lah. But you need to be able to communicate, okay, with the practitioners during the work round. Okay, so when you you can bring upstairs lah during the clinical work round all the file, the forms tu for each patient, and then you don't interrupt lah usually. So this is called preparation lah. You prepare before you go to the work round. So when it's the time for work round, then you go upstairs, then you go for work round patient by patient lah dengan specialist, doctors and nurses and other personnel, other healthcare personnel, and then you're not supposed to interact with patients masa tu lah, because you allow the specialists and doctors to explain and discuss. But you have to be alert lah what are the points that they are discussing. and if there are any issues that you can help, you can assist, kan. And also sometimes the plan, okay, the plan tu it involves your decision. So you make sure to take note everything, okay. And then dah finish work round tu, apa yang you dah respond, okay, that's fine. And then you need to record everything. And then yang you tak respond lagi tu, you pergi balik dekat your station, dekat inpatient lah usually, inpatient lah to clinical pharmacist, sebab dia sama je, dia still collect the medications for the patients, for her or his own patient in the ward, the 3B. Cuma more specialized lah, more closely monitored. If even though the inpatient pharmacist dah release dah screen everything and dah release the counter checking dah release, if the clinical pharmacist see something that is wrong with the medications given, and she knows better about that patient, and she just discuss, kan, maybe the prescription came last night and you prepared this morning by the inpatient pharmacist, and then this afternoon the medications change and all those things. So the clinical pharmacist can filter first. Oh, this has been cancelled, or the new medication should be this, so this should not be released and given to the patients, otherwise something else may happen. Because during the discussion this morning, they have discussed that this needs to be changed to this drug A needs to be changed to drug B or anything lah, or any information, kan, any changes. So if there's any ni pun counselling pun for discharge patient, let's say during the work round tu memang akan ada lah, okay, specialist and doctors dah plan lah, okay, confirm lah discharge this patient, kan. The discharge happen at after lunch lah usually, sometimes after 12 lah, after 12 kan, 1 o'clock, 2 o'clock nak process everything tu. So usually the discharge medications, you the inpatient pharmacist will not bring lah to the patient if the ward has clinical pharmacist, because the clinical pharmacist will bring all the medications. Kalau ada 3 orang ke nak discharge, kan, hari ni, so dalam pukul 11 macam tu dia bawa naik lah, and then counsel on the medications, on the indications, side effects, everything lah. But the clinical pharmacist knows deeper, more in depth on the conditions, kan, so dia can explain better to the patient compared to the inpatient pharmacist, because every day ni, kan, dia communicate with the patient and kan, follow around, dia tahu deeper on that condition better. So the inpatient pharmacist akan bagi clinical pharmacist je lah all the discharge medication ke counselling on in pen and devices, kan, any devices ke, dan dia akan bagi, and then dia samalah clinical pharmacist akan pergi dan naik atas tengok if patient can comprehend the information, then the counselling will be done. But if the patient requires assistance from the family or caretaker, then the clinical pharmacist will communicate with the family members lah. Alright, okay, so for those yang tak discharge lagi ni, macam biasa, you review the pharmacotherapy review tu, and then the intervention also being recorded, and also yang discharge yang CP4 tu, discharge referral tu kena isi lah, okay. So the clinical pharmacist basically deal with all these forms je lah, okay, but very specialized. Maksudnya the care of the patients under clinical pharmacist will be more effective because it's very tailored, okay, it's very focused. Any minor things, minor changes or minor macam overlooks on certain things will be identified by clinical pharmacists, and rarely lah for inpatient pharmacists to go deeper into each patient case. Okay, so I think we just move. So that's basically what you do lah, okay, as a clinical pharmacist. And then tengah hari tu you dah turun dah, kan, petang tu you dah respond to whatever questions yang you tak tak respond lagi this morning, and then also you plan all the you review all the therapy, and then if there's any information or issues, you tengok this morning sounds okay kan, tapi and then oh no, you find something new, and then you need to call the doctors or the specialists kan, and discuss about the new findings, and then if there is any, and then everything you need to record lah, whether in the hard copy document ataupun online ke sistem kan, ataupun in the pharmacist recommendation in the electronic, in the computerized system. Alright, so that's the basic process related to what pharmacy services in practice. Okay, pharmaceutical care ni dah year 1 pun dah belajar kan. So it's the care for the patients lah to improve the outcomes of treatment. So if okay, so you have all the principles of pharmaceutical care, the Strandler, Hepler, and Strand. On the pharmaceutical care, you need to just revise lah a bit, but it's basically patient focused. Okay, no more product focused. Okay, like you prepare all the extemporaneous ke ataupun distribute ke apa, just distribute, then you don't care about the patient, what happens after that kan, after taking the medication stuff. No. Now patient focused, memang you need clinical pharmacy niche area lah. Okay, pharmaceutical care. So patient focused at the start admission, and then even admitted for 1 month pun, and then until after the admission discharge tu, so the clinical pharmacist is still responsible for the patient to improve the outcomes. Of course, like if there is an involvement, clinical pharmacies in a team with doctors, specialists, and all those things. Like MTech, you will learn about MTech later, medication therapy, adherence clinic, specific to warfarin, specific to diabetes, specific to respiratory. The outcomes of the patients with very focused pharmaceutical care by the team are higher, are better, are more positive than those who didn't receive the pharmaceutical care by the clinical team. Okay. So relevant documentations we have checked just now, CP1 until CP4. So you don't have to, you need to know the function lah of these forms, but you don't need to remember lah the details, what's in the form. Okay, it can always change, okay, and updated. But currently they are using it lah. Okay. Alright, okay, prior to hospital. Okay. This is basically what you need. Okay. You need to have knowledge specialized in clinical pharmacy, pharmacotherapeutics, body system, ability to search for information and identify the wrong dose, wrong patient, wrong name ke, the wrong the lab parameters tu, you know how to interpret. Kalau high albumin, apa maksud dia? Then what medications in the list is not suitable? Kalau high creatinine, how to calculate, and then apa medications not suitable, and then how the dosage adjustment, what are the stages of deficiency kan, of the renal failure to ke, okay, a lot of things lah. So you need to master the knowledge in the pharmacotherapeutics lah. Oh, anyway, I have uploaded the, I'm not sure, I don't remember but there is a guideline I've uploaded on, I think pharmacy pesakit dalam something, or what, inpatient pharmacy guideline at MOH, at KKM, but it also contains the ward pharmacy. If you don't read, then you don't know. Dia tulis kat situ inpatient, but at the end tu, dia memang ada ward pharmacy and all the forms involved and the procedure, the process involved in the guideline. So please also be familiar with that, because it will help a lot lah in towards preparation for PRP and those things. Okay. So you can also search lah dekat ni website pun ada, okay, the components. These are just components lah for PRP. Ni guidelines. Okay. Can you see? I think I have given you this. Have you checked? Anyone have checked the guideline that I have uploaded?
Yes,
Ni.
doctor.
Okay, so you need to read this further lah to understand better. Dia in English in English better. Okay, I was just concerned if there's any international student because in practice sometimes it's easier to talk in Malay lah kan. But that's fine. If you adjust if there's any international student. But okay, so this is the occupation and these are the forms of care lah. Okay. Okay, with other healthcare providers to promote health, these are the aims lah, of course lah, monitor, initiate, modify medication, okay, and safe and effective. Kalau ada ADR ke apa pun, you are responsible because this is your ward, okay. But you always need to communicate lah because your patient sometimes very critical kan, then dia ada gentamicin, ada vancomycin, ada phenytoin, valproic acid, all these a range of medications which are narrow in therapeutic index, and you will learn in CPK, clinical pharmacokinetics, where you need to request the blood samples pre or post exposure of the antibiotics or the drugs, and you need to send to the lab, and then you get the level, and then you calculate whether this is within the range or not, because a slight lower or a slight higher of the medication will lead to toxicity or subtherapeutic. So it's unlike other drugs. There are a range of medications which have narrow therapeutic range, okay, to be effective. Otherwise, the toxicity will be very obvious, will happen to the patient. So, in this case, if your patients receive this kind of drug, then you need to communicate with the TDM pharmacist lah, CPK pharmacist. They will calculate lah the best dose, because you don't know if you don't calculate accordingly to the formula for each drug. Each drug tu dia ada formula dia, ada T-half dia ada volume of distribution dia ada whatever lah kan. Then depends pada your function, your patient punya kidney function, liver function, obesity or anything lah. Okay, all other components. So if you need help, you need to communicate always with the TIS pharmacist, the TDM or CPK pharmacist. Who else? CDR kan, kalau you in charge of surgical, usually ada cancer patient, ada radiology, and ada CDR, cytotoxic drug reconstitution tu, it can only be done by the CDR pharmacist, okay, not clinical pharmacist. So because it involves the aseptic technique tu, you need to watch the video on aseptic technique. So what you are going to do during the practical tu adalah something to do with TPN and CDR. Okay, how you need to take care of the procedure properly to prepare the drugs for TPN and also CDR. Okay, so we need to always communicate with other pharmacists in charge of respective discipline. Okay, here, the strand. These are the pharmaceutical care. It's very famous. To optimize the pharmacotherapy if you are clinical pharmacist, okay, and the clinical outcomes and okay, economic expenditure. Ni lah, you need to be familiarized juga lah with the choice or options for a cheaper drugs. If the patients have to buy certain drugs, very rare and expensive drugs ke, ataupun certain brand drugs, sebabnya dia tak boleh tolerate certain yang hospital bagi punya brand kan, yang tinggi. So always need to consider the patient's economic, and these are the forms. Okay, so basically one very simple lah. These are all the jobs of a clinical pharmacist for documentation. Okay, these are the forms. Okay, ini you akan practice lah during the third year and fourth year kan, PT. In PT, memang inilah kerja you as a clinic. You are being trained to clerk cases and doing the job clinical pharmacist. Okay, and the knowledge is of course more extensive than inpatient pharmacies regarding the drugs. So inilah your job to complete all these things by interviewing the patients. Okay, report form, okay, all this, sama lah isi juga ni, discharge. Okay. Discharge ni can be to other hospital if the patient is not stable yet, and also can be to the clinic, okay, to collect medications, future medications. Can you fill in lah everything kat sini, your patient, for your patient. Components. Okay, so these are the steps. Okay, I cakap tadi kan, pagi-pagi you buat ni, history taking, tulis laju, lepas tu complete all the ni. So that you tak blur lah masa you pergi clinical work round tu. Case marking sama lah, pharmacotherapy rounds dengan all the specialist apa, and then you review lah the medication usually. Ini you can do in the morning juga, and also after the round lah, sebab there is no way you are able to finish in the morning tu. So petang lepas you balik dari work round tu, you can do this again, and then in contact kan. Then reconciliation, you can also check kalau patient tu ada apa, ada ubat lain kan kat rumah, and you can also yeah, sometimes there are so many prescription, sampai dah confused and ada yang duplicate. So you need to you can transfer all the information on the latest and update all the information on the latest regimen to the ni, so that tomorrow the team can easily see, oh, the patient took this from home, and then oh, this one was introduced yesterday, and then on this one it was discussed yesterday but it's not given. So you need to update the ni lah, the chart ke, the medication ke, the plan semua tu, reconciliation, counselling yang macam tadi lah, dan discharge lah. Okay, discharge plan. Okay. Professional, of course you need to be professional lah. Alright, medical information, always on documentation. Okay, ni memang kena lah, this is the basic skill. Okay, for patients to trust you and tell all the stories, you need to build the rapport with the patient, and to explain the plan, tadi lah, ada explain all these ones. Okay, this is the same thing. Anything that you don't understand, you can, because I'm not going to read lah, this is just for you to refer the steps kan from the book lah, but I'm going to just explain further, describe further how it's done. Okay, any question? Dengan someone? Any questions so far? No? Okay. Okay, history taking. Okay, ni issues juga lah, non-compliance. Ni memang you je lah yang boleh ni investigate kan patient, and also advise lah on the non-compliance kan. Dia of course lah, usually ramai yang masuk hospital tu because non-compliance to medications lah. Then you need to investigate whether they experience due to side effects ke, atau non-supportive environment ke, macam environment tu family members tak supportive ke, tak tolong ke kan, and with ada macam disabilities ke of the patient. So you need to investigate all the underlying reasons and conditions of the patients. Okay, ni memang you need to ni lah, ask the patient, okay, interview the patient tu, you do all this. Okay, ni memang you kena ni lah. Sometimes dia tak bagi tahu doktor, dia takut ke apa kan. So you have more time than the doctors, and you can do a better rapport with them, and then you need to ni lah, make sure have all this, because there's so many patients taking the supplements, OTC and herbal preparation. Okay. So you need to have the counseling skills to address all these issues. Okay, same. Okay, these are the current medications. Medications ni, kalau let's say hari ni dia ada 15 medications, esok dia ada 18 medications, ditambah apa semua tu, you need to record this every day. Okay, kalau macam the whole month tu, the patient dah ni, so you dah ada record dari the past 1 month, every day, the changes in medications and regimens, and the lab parameters as well, the lab Okay, when introduce this medication, what happens to the lab parameters? That is the outcome actually. When whether the medication is working or not. Okay, to normalize the lab parameters, for example. Okay, record problems by okay, shall review, highlighter. This is very easy kan to understand. Okay, of course we need to play an active role. Because you as a female mesti tak boleh lah nak senyap je, nak pasif je kan. So you always need to be active. Kalau you tak tahu pun, you still need to show lah your your keen, your interest, your untuk explore further and provide the information kan, walaupun you are new for example to the team kan, then later you can provide more information and respond to the questions. It's really requirement. Okay. Daily basis, I've mentioned this. Okay, patient progress pun daily basis. Okay, so that's parameters ni. Kalau ada infection, apa parameters infection? Siapa tahu infection punya parameters apa? Kalau patient tu ada infection. Anyone?
Having fever.
Okay, fever lagi.
High white blood cell
Okay, what blood
count.
cell? Okay, C-reactive protein. And other thing, so you need to also differentiate lah. Viral ke, fungal ke, antibiotics, bacteria ke, you know, so that you can you can identify lah antibiotics ke, antiviral ke, antifungal kan, and then CNS, that is the most important thing, culture and sensitivity kan. So you need to know lah all the types of microorganisms kan, and then the guideline shows that for this microorganism, for this condition, for example pneumonia, community acquired pneumonia, so what's the first line? Okay, when you introduce the empirical therapy before the culture and sensitivity results, is it working or not? If it's not working, then what is the result of the culture and sensitivity, so that you can change to the sensitive antibiotics kan, the options they are sensitive to what kind of antibiotics and all those things. So you need to know lah kalau infection apa, kalau heart failure apa kan, heart failure, input output, the ejection fraction and all those, the knowledge on the pharmacotherapy. Okay, these are the skills, these are by practice lah. Always need to know. Ini memang you dah dalam kepala you dah. Orang tanya you terus tahu. Summarize. Okay, you need to have all the skills lah. Okay, to summarize. Janganlah kalau baca tu, kalau present report tu, because you sometimes you need to present like once a month. You need to choose some cases to update, for the continuous pharmacy education lah. To update the people, what's about the cases and what happens more. So you have the skill for presentation to kena effective. Okay, janganlah drag, slow, kan. Okay, because this is your case, you need to have. Okay, janganlah bergaduh dengan doktor ke, dengan farmasis lain ke, dengan nurse ke apa. Okay, so you need to have a good attitude, good personality, and professional. Okay, be professional with other healthcare teams, because we all have own strength and weaknesses. Okay, so don't put too much ego ke apa, something like that lah. You je yang tahu everything kan. Orang lain tak tahu. No, of course there are people yang tahu juga apa yang you tahu. Okay, and they know what you don't know pun. So we always need to give and take lah, and share all the information kan, and accept the intervention. Kalau let's say lah you recommend to do this and they don't accept because they have their own reason, then they are responsible lah. Meaning to take note je lah, just document that you propose this and then they disagree and they wanted to continue the same or apa tu, and then that's fine, that's totally fine. Okay. There is no one method that can fit all patients. Kalau you cakap ini sesuai, maksudnya maybe for this patient tak sesuai ke kan. You have to have positive and open mindset lah. Okay. Because there are always conflicts between healthcare teams. Okay. There are always conflicts. So avoid conflicts lah. Try to avoid, because your focus is the patient care. Okay. Of course need to be up to date. Sometimes kan dia tak available, dosage forms ni tak available lagi, so tiba-tiba dia dah keluar dah this dosage form, so always need to be up to date. Okay, always need to update your information. These are the basic steps lah for PPT lah kan. You prepare pagi-pagi tu, participate during the work round pukul 10 tu, and then perform lah your ni kan, intervention ke apa if there is any. Pergilah interview lagi ke kan, ada something wrong lah dengan patient, then you naik balik lepas work round tu you interview, betul ke pakcik macam ni kan, and then kenapa buat macam ni, all those things and macam dia sebenarnya dia dah guna inhaler setiap hari ke apa kan, tapi the method tu bila you pergi assess balik, dia tekan tu habis semua drugs ni keluar kan, keluar asap apa benda, tak masuk pun dalam kan airway tu for example. So you know kan, so walaupun dia compliance tapi the technique is wrong and the medication doesn't reach the target area tu, and you need to prove lah your skills and ability lah to improve the outcomes of the patients, prove to the teams and prove to yourself lah. Okay, so these are the components of prepare. Okay. Ni lah, you need to PDA ke, stamp ke, zaman sekarang pakai apa tak tahu lah, zaman dulu pakai drug information, calculator kan, PDA adalah dulu juga. So now you have everything online kan, so you need to advance and update yourself. The schedule for work rounds kan, communication chat ni pagi tu. Participate effectively, okay, present relevant PCI, pharmaceutical care issues. Sometimes if they miss something about pharmaceutical care issues, then you need also to raise the issues during the work round. Okay, intervene when necessary and discuss with this diplomacy. Form, follow up, okay, data account, and of course everything is to be documented. Okay, these are the some of the issues lah. Okay, these are some of the issues during the medication review kan. So you need to correct lah all the any incomplete instructions ke. You check macam tak ada storage yang proper kan, then you need to intervene. Ini sometimes ni lah staff nurse lah. You have to have a very close relationship with the staff nurse because they are taking care of your patients. They administer your patients medication. Okay, so please be careful and discuss every single thing with the staff nurse, and so that no conflicts or issues arise later on. Check if the dosage order has been administered. So ni job of staff nurse, administer the medication, detect any problems related to ni kan. Incompatibilities, drug stability. Okay. So here you can monitor closely lah because you are taking care of 30 patients je. Kalau inpatient tu they are taking care of hundreds of patients, then it's very difficult lah to monitor closely. Okay, since you are taking care of 20 or 30 patients, memang you can check every single drug administered to the patient. Okay, and the rate kan, infusion rate apa, the dilution and the incompatibilities dengan other medications ke. Okay, sign and date and okay. So the chart ni dekat, kalau manual you kena naik atas lah tengok. Okay. Kalau dekat computerized, you can check je, ni dah administered, ini ordered tapi tak administered lagi, then you call. Ini kenapa tak administered lagi ini, lepas tu maybe the staff nurse macam tak sure kan, dose ke apa, or how to prepare the solution ke apa semua, something like that, so you can discuss further. But you can always monitor lah dekat computerized system kan, yang mana dah order tapi yang mana yang belum administered ke, atau any problems develop after administration ke, very closely monitor. Okay, the medication review checklist. Okay, if everything okay, then you can also take note lah and sign kan. Okay, everything is fine, no problems. Okay, ni I mentioned just now lah, accurate list, because sometimes they are so messy and because they are everywhere kan, especially kalau manual memang very messy, and if you see the case pun dekat online dekat tu too messy, macam repeat the same thing. Maybe ada 3 doctors yang review that day kan, pagi doktor lain, petang doktor lain, malam doktor lain. So they just copy the plan, and then it looks very messy. In which one is the latest one, the updated one, you're not sure kan. Inpatient will have a lot of problems with this lah kalau you tak update. So it's important lah to update all the at all levels lah, to make sure the accuracy of the okay. Medication reconciliation. Okay, most accurate efficient list. Okay, reduce medication related errors. Okay, tak adalah 2 kali 2 kali administer ke apa kan. Okay, we have discussed this. Okay, misunderstanding ke apa, you need to correct lah the patient punya understanding. Okay, individual or group. Okay, with similar diseases, and of course by the consent of the patient. Okay, individual bedside and discharge pun boleh. Okay, information. Okay, these are just information for the counselling storage condition. So these are the basically apa yang you nak counsel the patient tu, these things lah you need to follow the step kan. Okay, Assalamualaikum, counsel ni boleh kata and then okay, nak bagi ubat ni nama apa, and then ni untuk apa kan, indication, and then the dose untuk apa, and then berapa biji, berapa ml kena ambil, and then kena completekan ke tak kalau antibiotik tu, kalau tak, kalau yang one necessary tu tak perlu complete kan, all those things. And ni kan kita dah discuss hari tu semalam kan, yang side effects ni kena tone down a bit, but please just warn the patient lah kan, kalau tak tolerate any side effects, then they need to inform the doctor or pharmacist lah. Route of administration. Okay, when suitable lah, kalau patient tak dapat swallow, tak adalah you nak bagi oral kan, you kenalah switch to IV ke apa-apalah kan. So depends for the condition. So this is also important lah. Kalau peds kan, pediatrics, tak adalah you nak bagi tablet ke kapsul ke apa, everything must be in syrup lah ataupun IV. Okay, storage condition, the stability, okay, of each medication, and what happens kalau miss dose, you nak kena apa, nak kena ambil bila, kena ambil double ke ataupun just ignore and then wait for the next dose ke, something like that. Okay, so okay, same thing. Okay, you can just read this documentation. I've discussed this. Discharge. Okay, safe course. Okay. Alright, so discharge ni maksudnya inpatient tak payahlah kalau dah work tu dah ada clinical pharmacist. Okay, transcribing ni, not all hospitals do this. Dia kalau doctors or that administrative unit allow the pharmacist to transcribe the discharge medication into a prescription because they are so busy ke, atau to double check because maybe the screening tu banyak sangat mistakes, then they want the clinical pharmacist to transcribe first before they order the medications. So you have the ni kan information dekat note, dekat plan apa semua, clinical notes everything. So you have the prescription and then you are authorized to prescribe lah. Maksudnya they prescribe, you transcribe, you transfer lah the information. So it's confirmed that this patient is going to be discharged with these 4 medications. Okay, then you are the one who write at the at the prescription slip. Okay. So you transcribe lah. It's not like you prescribe, you decide they on the ni. But not hospitals practice this. Not many hospitals. A few hospitals only lah in Malaysia. In overseas, of course, they are very more advanced lah. Alright. So understand? Alright. So discharge summary, prescription, if error. Okay. Sometimes kalau you as inpatient or satellite pharmacist ada error dekat patient kan, you supply kan kat medication trolley tu, tapi ini ward 3B yang in charge by this clinical pharmacist. You can always refer clinical pharmacist ni sebab dia knows better, and then you tell all the issues to the clinical pharmacist, because ni lah, the clinical pharmacist will address all these issues lah and find the solution. Okay. So, send to the ward ni, ini clinical lah akan bagi. Inpatient satellite akan prepare je, and then inpatient akan bring to the ward. Okay. Okay, so there is a need to check, to ask the patient to bring all the medications from home. Okay, so that you can check and make sure, because the history from patients only, verbal communications only will not complete. You need to ask the family members to bring all the medications from home so that you can assess which medications and when, and then what have been changed, and then expired ke tak, and then betul ke compliance. Tengok ada macam a stock of 1 year stock of medications kan. So what happened? So that's why you need to explore further lah from the patient based on the medications at home. Okay. So if there's no problem, memang patient guna and ni kan proper compliance and everything, then you need to reuse the medications yang at home tu before ni lah, maksudnya in the plan, okay, metformin, insulin, use patient's own medications. Okay, dekat note tu, maksudnya the doctors will not order the medications from the inpatient unit. Okay. Okay, any remaining, okay, discontinue the ward and return to the pharmacy. Okay, this is to reduce wastage. We have discussed this. Right, bedside dispensing and discharge counselling ni sama dengan ni lah, the components and flow sama lah dengan inpatient. Okay, inpatient pharmacy. These are the RPs, category of different ni lah, different reference lah, but similar lah. So these are different references, tapi dia punya classification tu sama. Okay, doesn't matter lah which one you want to use. Okay, duplication, semua ni, untreated ni semua sama je. Subtherapeutic, failure to receive drugs, because tak administer. Okay, drug interactions. Kalau ada macam dah 10 drugs tu, confirm lah ada interactions. So kalau you tak jumpa tu, memang you tak study lah maksudnya. So memang ada. Tapi interaction tu pun adalah potential ke actual ke kan. Okay. DRP tu ada potential and actual. Sama pada Kimball pun is one of the reference for DRP. Okay, this assessment je lah. Kalau you buat DRP tu kan, 3 bulan tu you plug the case and then you choose case for the references. You choose the case and then you present. Okay, untuk you pass lah untuk clinical pharmacy. Alright, so I think that's all. Do you have any questions? Any questions?
Doktor. Maksudnya inpatient pharmacy tu dia kena dispense jugalah untuk patient yang ada clinical pharmacist ni.
Maksudnya distribute ke?
Dispense dalam trolley tu, ya, inpatient pharmacist dia kena buat jugalah.
Maksudnya trolley tu akan datang dari ward 3B yang ada clinical pharmacist tu kan? Yes. Macam on the trolley day, ward akan hantar the medication trolley. Kalau ward 3B tu ada 30 orang kan. So okay lah, dia akan hantar. And then the inpatient pharmacist still need to prepare, screen, label, filling and counter check and provide the medications using a unit of use ke unit of dose lah, depends lah. And then the staff nurse will administer the medications. Thus, clinical pharmacists have nothing to do with the preparation at the inpatient, but they will monitor and screen the apa yang patients dia dekat 3B tu receive from the inpatient pharmacist. Okay? Because there is no way lah dia akan buat everything dekat 3B tu, sebab the job is just to clock the case, document everything, participate in the work round, and pharmacotherapy review and intervention and documentation and all those things. Dia tak buat the screening, medication trolley, drug DD, PSY tu kan, all those things, inpatient pharmacies. Tapi inpatient pharmacy supply to all wards yang tak ada satellite pharmacy. Satellite pharmacy akan in charge kan. So let's say lah this 3B ni ada satellite pharmacy dekat level 3 tu. So satellite pharmacy akan distribute the medications to the ward lah. Tapi maksudnya satellite dengan inpatient pharmacy ni role dia sama. Tapi maksudnya walaupun this the ward ada clinical pharmacist, the role of inpatient is still the same to all wards. Clinical pharmacist tak buat the job of inpatient pharmacist buat.
Oh. So kiranya inpatient pharmacy ni kena check dengan clinical pharmacy, kena check the medication semua.
Not necessarily. Masa inpatient pharmacist buat kerja tu, nak supply the medication trolley tu, clinical pharmacist dah dekat work round dah. Ke atas macam mana nak check kan. Dia buat tu every day. Okay, every day inpatient pharmacist prepare kan. Every day clinical pharmacist naik atas untuk work round. So there is no way dia boleh check together lah, unless later petang tu ada any issues, then they can discuss lah. Okay. But in the meantime, in the macam pagi tu just supply je dulu based on ni lah, macam you ni lah, kalau ada issues ke apa, you can call the doctors, verify all the information, and then only you screen the prescription and then buat correction and supply lah to the trolley, medication trolley to all the patients in the ward. Okay, and then the clinical pharmacist akan review balik lah what have you supplied to the patients in the ward and whether it was administered or not kan, and then review whether to stop ataupun apa plan ke apa, all everything need to document. So the then they need to communicate lah together kan.
Okay, Doktor. Faham. Thank you.
Okay, anything else? Question? Any other question? 2 more minutes before your next class. Any other question? No. But it's very basic lah, and it's not our main job at the hospital lah. Kalau macam satu hospital tu dia ada pharmacist, the pharmacist will be stationed at the